It's okay.
All right, go ahead.
Gait belts, take 3. Hello everyone, my name is Maddie Ablitz. I am an occupational therapist and owner of Threshold Therapeutic. Welcome to the Home Care OT video series. Today I am here to talk to you about gait belts. Gait belts are essentially a belt that is designed to help with gait, or walking, or balance, or stability, and in some cases transfers. There are several different types of gait belts that are available to use, but the concept is the same. So I'm going to talk you through the concept, and then I will show you a few different options and how to best get them on, tighten them, and see how they work. So the concept of the gait belt, first and foremost, the gait belt needs to be put on low and tight across the hip bones. My hip bones are right here, the gait belt is right on top of it, so find the hip bones of your clients, put it around there, get it as tight as it will go. The reason that I say low and tight is if you are in a scenario where you are using this gait belt for any kind of transfer, where you're going to be doing any amount of lifting, if you have this gait belt too high up and I sit down and someone's going to help me lift and we lift on 3, 1, 2, 3, lift, no matter where that gait belt is and how tight it is, the tendency is going to be for that gait belt to ride up. So with female patients, we want to be sensitive. When that rides up, it comes into a sensitive area. Get that gait belt as low and tight as possible. My personal preference, if I am helping someone with lifting or transfers, I actually prefer not to use a gait belt specifically for that reason. It moves even if it's tight. I prefer to use my hands, so if I am going to lift or transfer someone, I'm either going to go for hands on the hip bones or hands around underneath here and holding behind the ribs. I feel like I have more control that way. What I will use this gait belt for is if I am helping someone with stability for balance when they're standing or walking. So during a transfer, I may have that gait belt on the person so it's ready to go. I might lift that person using my hands, but then I can transfer over to that gait belt once we're standing if they need some help with balance. If I'm walking with someone in the hallway, I also prefer to use a gait belt. I don't want to be walking behind someone with their pants bunched up in my hands because that's not very cute if you're walking around in a retirement community. So concept of the gait belt, get that belt low and tight across the hips. There are a few different kinds. This is my personal preference of a gait belt. It buckles and opens and closes very easily. So if it's for a single client, it stays the same tightness. I actually don't have to adjust it. It's also made of vinyl, so I can clean it with a sanitary cloth. If I were in a facility or, I'm in home care, I use this on several different clients, I can clean it between patients. So this is very easy to tighten with your adjustable strap. A quick release, buckle and unbuckle. What you're most commonly going to see is this canvas style gait belt. You might see these in an outpatient clinic or in rehab, or some clients have them in their home. These are not very easy to clean between clients, so usually these are a single-use gait belt. And they have a metal buckle that uses these teeth mechanisms to tighten up around there. It is very important when you're using this canvas style gait belt to make sure that you have it on in the correct direction. If the gait belt is inside out or the teeth aren't facing the correct way, you're not going to get it very tight. So first clue is finding the inside lining with the tag. You want that facing the patient. That's going to help you get it oriented correctly. So to get this one tight takes a little bit of skill. So I'm going to put this on. I'm going to loop it through. And you know that your teeth are facing the correct direction when the teeth on the gait belt are facing the excess strap that you are pulling through the belt. So what I'm going to do to make sure that I get this tight is I am going to get it low and tight across the hip bones. I'm going to pull this gait belt as tight as it goes while maintaining pressure this way with one hand. I'm going to take my other hand and I'm going to go ahead and start threading it back through the belt on the other side. The reason that I do this is if I let go of tension, the gait belt is going to be loose and I'm never going to get it tight. So while I'm keeping tension here, I'm threading that gait belt through, and I'm going to keep tension all the way through until my finger is the last thing left, and now I am left with a tight gait belt. So again, concept of gait belts, low and tight across the hip bones. Be careful if you're going to be lifting up, because even though this is very tight, it pulls up very, very easily. Consider using your hands for stability during the transfer, and then having this gait belt as your option to help somebody with stability and balance once they're up.